Assalamu alaikum. I'm Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine, Bashundhara Ad-din Medical College. Today, our topic of discussion includes in the vast topic forensic psychiatry, that is delusion. The definition of delusion is false, unshakable belief despite evidence to the contrary which out of keeping with patient's social, educational and cultural status. The delusion may occur in different forms such as delusion of grandeur, that is feeling of greatness, power or even wealth. The person feels himself a wealthier, a powerful person among the others. Delusion of persecution is something bad is happening around him that may include and even harm him. Delusion of influence is all thoughts and activities of that person are controlled by the others. It is a false belief and according to this he may act or enact. Delusion of reference in which he is being referred to by all the agencies and even conspiracy are being held against him. Delusion of nihilism is to believe in the existence of earthly matters as he may feel that the earth does not exist, even the existence of him does not exist at all. Delusion of infidelity, it is a person feels that his wife is unfaithful or betrays him in other ways. From this delusion of infidelity that may also term in Othello syndrome. Erotomania is the person believes that someone is deeply in love with him or her, whether the fact is others. Medical legal importance of delusion is the person such is not fully responsible for his antisocial behavior or acts, but he may held and may captive also termed. Suicide is a major risk from delusion. Combination of murder and suicide is common, also held is observed in case of running amok from cannabis intoxication. The doctrine of diminished responsibility is applicable in this delusional state. It is to an insane person who does an unlawful act due to delusion, which reduces his power of reasoning and understanding capacity. If he commits some act which is not directly related with the effect of the delusion, but has an indirect bearing, such person cannot be regarded as fully responsible for his illegal act. Some disorder of emotion includes apathy, that is lack of emotion, euphoria, an exaggerated feeling of well-being, anxiety, apprehension, tension or uneasiness that stems from the anticipation of danger, which may be internal or even external. Agitation, like as feeling of inner tension expressed with excessive motor activity, and panic attacks, that is panic in a severe state of anxiety. It is characterized by catatonic motor behavior. Another disorder of emotion is phobia. Phobia is defined as persistent irrational fear of a specific object, activity or situation that results in compelling desire to avoid the phobic situation. It may form like as agoraphobia, the fear of open space, as well as claustrophobia, fear of closed space or confined space. It commonly occurs in case of lift users. Nyctophobia is fear of darkness. Numerophobia is fear of number, as he cannot count any numbers. Arachnophobia is fear of spiders. Hydrophobia, fear of water. Aerophobia is fear of high places, as height phobia. Also, hippopotamonstroquilanophobia is a term, the longest and largest word, and the fear from largest words is termed so. Somnambulism, it also occurs as during sleep walking. The person while sleeping may get up from bed, open the door, walk out a distance and return to his bed to sleep without even remembering it the next day. The mental faculties are particularly active, and so concentration on one particular idea that he may solve a difficult problem or commit a crime in such that may in case of criminal acts. Such person is not criminally responsible for his actions during somnambulism. Now, psychosis and neurosis, two important terms in case of insanity. as psychosis is characterized by gross impairment in reality testing, as the person is withdrawn from the reality. He is living in a world of fantasy. The term psychosis derived from psych means mind and osis means disease. The disease of mind is known as psychosis. It is a Greek term. There is impairment in social, interpersonal and occupational functioning, disturbance in personality, there is loss of insight, there is presence of delusion as well as hallucination. The common example of psychosis are schizophrenia, mood disorder. This may also include in case of drug induced like as alcohol, heroin, morphine, cannabis indica, cocaine and even LSDs. Alcoholic psychosis may also detect in other mental illness such as delirium tremens, Korsakoff psychosis, alcohol dementia, even sexual jealousy and committing crime. Heroin or morphine may cause also no respectful and trust, lowered intellectual efficiency and loss of interest in the environment. Cannabis psychosis may turn to addiction, hallucination in sensus type, sexual jealousy and crime, even delusion of grandiosum or delusion of persecution. Cocaine psychosis will be turned into delusion of persecution and hallucination of tactile type, that is cocaine bug or cocainism. Psychosis may also follow the epilepsy, the pre-epileptic confusional state, even masked psychomotor epilepsy. Neurosis is when a patient suffers from emotional or intellectual disorders which causes subjective distress but does not touch the reality. There is presence of insight where psychosis it is absent, presence of symptoms that causes distress to the patient physically. Personality is restored, content with surrounding is preserved. The example of neurosis are anxiety disorder, phobic disorders, even obsessive compulsive disorders. In both cases, testamentary capacity is a vital point. The person capable of making a valid will is called testamentary capacity. For a valid will, there must be some certain conditions as understanding regarding the will, knowledge of the property to be disposed, ability to recognize those who may have normal claims of the testator's bounty. A will be valid if deaf, dumb or blind persons who are not thereby incapability for making a will are able to know. Lucid interval is also known. If a testator commits suicide immediately after making the will will be valid. Presence of delusion are not affecting in any way the disposal of the property or the person's effect by the will. The validity will be invalid of the will if it is executed under influence of any person, under any fear or even influenced by any substance. Imbecility arising from advanced ages or by excessive drinking is also invalid. If the testator is insane, the will be invalid. The validity of also required some facts as it will be written properly and signed in presence of the witness. The testator must be more than 18 years of age. The will should not be made under any force, undue influence or dishonest representation of facts. A legatee cannot attest a will. A will can be revoked or modified any time before the death of the testator by himself, and the will comes into effect after the death of the testator. These requirements should be fulfilled to make a will valid. This is the testamentary capacity. Along with this, the mental illness also forms that are psychiatric illness term. It includes the organic mental illnesses such as disturbed consciousness, disturbed cognitive function, presence of physical illness, presence of neurological features such as ataxia, dysarthria and also old age onset as termed as senile syndrome. In case of mental illnesses, disturbed consciousness is known to be in serious form delirium. It is a serious disturbance in mental abilities that result in confused thinking and reduced awareness of the environment. The start of delirium is usually rapid, but within hours or even few days it may commit. Predisposing factor for delirium is older ages above 65 years, males are common, cognitive impairment is occurred, even dementia may turn. Physical comorbidity including cancer, cerebrovascular diseases. Psychiatric comorbidity includes depression or frustration. Sensory impairment includes vision or hearing. Functional dependency of certain facts may also include the physical fitnesses as dehydration or malnutrition. Alcoholic dependency or even drug dependency may induce delirium. The causes of delirium may classified in metabolic, infectious, medication oriented, physical or psychological stress, surgery, general anesthesia, vascular and even others, including the metabolic conditions, malnutrition, dehydration, hypoxia, electrolyte imbalance are common. Infection includes the respiratory tract or urinary tract infection that may involve delirium. Psychological stress includes immobilization or restraint, urinary retention, pain. Surgery includes the cardiac or thoracic operations, medication involved and also the others as substance withdrawal like as alcohol, diazepam, substance intoxication and even traumatic head injury. Drugs causing delirium commonly are like ibuprofen, ketorolac, the NSAIDs. Sleep medications like diazepam, barbiturate. Medications for mood disorder are tricyclic antidepressant, chlorpromazine. Antihistamines also induce delirium. Steroids including prednisolone, corticosteroid. Antiparkinson's disease like levodopa, anticonvulsant, diazepam, barbiturate, anticholinergic, atropine. Symptoms and signs including reduced awareness of environment, poor thinking skills as cognitive impairment, behavioral change, also emotional disturbances. Differential diagnoses are psychosis, that is consciousness and cognition may be impaired, completely functional. Also dementia, depression and developmental deficit. Thank you. That is all for today. Assalamu alaikum.